And what we show is that the patients who got the fasting mimicking diet for 5 days a month used much less medication than the group that got the regular treatment. So the majority of the patients who were treated with medication at the start of the study, who used the fasting mimicking diet, could stop that medication. And while in the control group, people used more medication at the end of 12 months.
This is the Longevity CEO, where we explore the science of metabolism, cellular renewal, and the future of longevity.
This is Dr. Joseph Anton, and it's a big pleasure in this session to be hosting Professor and Dr. Hanno, who has been one of the leading experts actually in fasting and longevity, has done multiple clinical trials on fasting and longevity, and he's a prominent doctor at the Leiden system of hospitals in Netherlands, one of the leading European hospitals in healthcare, but also in fasting and longevity. So I would invite Dr. Hanno to first introduce himself, and then we're going to have a big discussion on how can fasting contribute to longevity. And Dr. Hanno has done a lot of trials on fasting for cancer patients and fasting for diabetic patients, what those trials have been about, what are the outcomes, and how can people today benefit from these interventions. Welcome, Dr. Hanno.
Thank you, Joseph. It's a pleasure to be here. Yes, as you told the audience, I'm a doctor. I'm a clinical endocrinologist actually at the Leiden University Medical Center, and I'm a professor of diabetology. And I've been interested in the health benefits of fasting for a very long time now, approximately, I would say 15. I became interested in aging and the aging process, and I learned about the trials that showed that fasting or intermittent fasting actually can extend lifespan and also improve health. And I was intrigued by the idea that we could perhaps help my patients and other patients with fasting. And that's why I started doing trials investigating the impact of fasting at first on cancer, in particular the effects of fasting and chemotherapy in breast cancer. And then just recently, we did a trial to evaluate the impact of periodic fasting in type 2 diabetes, which in the details, we probably will go into a little later. But I strongly believe that fasting is a powerful intervention to improve health in particular, and perhaps it will also extend lifespan in humans, but that's less certain. But I think it definitely has benefits for health.
That's fantastic. And I've had the chance to meet you probably maybe 8, 9 years ago on a trip. You were coming to Los Angeles and partnering with Dr. Walter Longo on the fasting trials at USC, prominent fasting experts, and I have tracked you for the last 7, 8 years. The work that you've done at Leiden has been unbelievable. Is going to change in the medium and long term the way we do medicine. Today, we do medicine with drugs mainly. And I think you worked on fasting and the fasting mimicking nutrition to have an alternative support for the doctor and the patient when it comes to cancer and diabetes. Should we separate maybe cancer and diabetes and talk about the
Sure.
concept why to do fasting and fasting nutrition and why periodic fasting for like a patient, it seems you worked on breast cancer. Can you tell us a little bit how come a patient that could have breast cancer or there are other trials probably happening on other cancers, but why a patient would do fasting and what it does biologically to the body when they have such a condition?
Yeah. So you have to realize that fasting is an intervention that will protect your body against all kinds of stressors, all kinds of toxic agents and other threats. And I always like to think in evolutionary terms because what in the old days, thousands of years ago, humans were often faced with food shortage, and it was essential to survive these periods of lack of food. And that's how our physiology actually developed. It developed in a way that when there's a shortage of food, our healthy cells start protecting themselves against all kinds of threats to survive that particular period of food shortage. And at the same time, we know since not so very long that cancer cells cannot protect themselves against do not react in the same sense. So they cannot switch to this cellular mode of protection, and they actually suffer from nutrients shortage when we fast. So this concept, which is called differential stress resistance, was discovered actually by Walter Longo, you mentioned before. And years ago, we thought, well, this is something that we should try to see whether when we apply that to patients who have breast cancer and get chemotherapy, this chemotherapy is obviously bad for cancer cells, but it's also bad for healthy cells. And the idea was when we have people fast around chemotherapy course, then their healthy cells may get protected against the threats of chemotherapy, while the cancer cells that cannot make that switch get more sensitive to the chemotherapy. And that's why we tested the possibility that fasting, or at a later stage we did fasting mimicking diet, or we go into in a minute, I guess. Fasting mimicking diets would do two things in patients with cancer. First, protect healthy cells against the threats of the chemotherapy. Secondly, render the cancer cells more sensitive to the chemotherapy. And that's basically what we evaluated over the last, let's say, 10 years.
And so is it that when there's no food, the normal cells say, well, we're in fasting mode, let me protect to survive, and let me not replicate and not grow and not invest in expansion and just protect myself and rejuvenate. We hear the word autophagy with fasting. There's other ways that fasting induced rejuvenation as well. And it is that the cancer cell, by definition, loses its inhibition factors and keep growing, and then needs food to survive, and need the growth factors as well. And now it's being lost and deprived with fasting, and therefore gets weakened and sensitized to the chemo intervention or the hormone intervention or whatever intervention is happening.
That's exactly how it is. That's exactly how it is. And we did two trials, a very small trial at first to see whether it was safe to fast around the chemo, and it was
And
very
is that
safe.
what is that water?
That was water only fasting. Water
How
only
many
fasting.
days? How many
Um,
days?
we did in total around the chemotherapy for the first study was 2 days of complete fasting, and it would turn out to be very safe. There were no major side effects, and it also we had indications that the fasting actually protected healthy cells. There was less DNA damage in healthy cells. We tested that, and we couldn't the trial was too small to actually determine whether the fasting sensitized the cancer cells for the chemo. But since we learned that it was safe and it appeared to reduce damage to healthy cells, we thought we have to do a bigger trial to see if we can actually show that the cancer gets more sensitive and that it reacts more strongly to the chemo. And that's what we did in the second trial. And we did show in that particular trial that cancer cells, this was again in women with breast cancer,
How many participants in the
uh,
trial?
128 in
Oh, wow.
total. So half
And
of them,
was that on water fast or on a fasting
no,
nutrition?
no, that was a trial we did with a so-called fasting mimicking diet. And this is a diet designed to mimic the effects of water-only fasting, but you can eat something and in particular, healthy fats, but no or very little protein and virtually no carbohydrate, the refined carbohydrates.
Mhm.
And that particular diet has similar effects as total as water only fasting, but you can still have some calories, which makes it a bit easier for people to do it. So this particular trial, there were 128 people. That half of them got an advice to eat healthy around the chemotherapy, just no specific advice, but eat as healthy as possible. And then the other half got the fasting mimicking diet. And what we showed was that the response of the tumor appeared better in the people who used the fasting mimicking diet, which was 3 days prior to chemotherapy and on the day of chemotherapy itself. And
it's a
it's a
4-day nutrition
it's
protocol.
basically it is, yeah.
And
Yeah,
then the patient starts the fasting mimicking diet, say chemotherapy day -4, -3, -1, and the day of the chemotherapy.
exactly. That's how it is. And that study showed that there was a better response of the cancer to the chemo. However, unfortunately, the power of the study was not enough to be absolutely sure. So that's the reason why we currently do a second study to confirm those findings in a even bigger study population. So we have to wait for the results of that particular study before we can definitely advise people to do the fasting mimicking diet.
That's fantastic. And how many people in the new trial?
250 um, at least. I'm not completely sure whether it's even 450, but I have to look into that. But we did a very very thorough power calculation now, and it's a lot more people.
That's fantastic. A lot of cancer patients, I mean, breast cancer patients actually gain weight, so probably also they're getting a little bit of help with the fasting mimicking nutrition. But some cancer patients lose weight with cancer. Does the fasting mimicking diet, does that is that induce more weight loss, or it protects lean body mass and just cut the fat? Or can you talk a little bit about the impact of the fasting nutrition for patients and regarding their weight as well?
Yeah, if you use a fasting mimicking diet for a longer period of time, over a couple of months, for example, let's say 4 to 5 days, and then every month the fasting mimicking diet, then you actually tend to lose weight, in particular fat mass, while muscle mass is preserved. That's something that we showed just recently in the diabetes trial we did.
Critical. That's a very critical that's a discovery, because typically perceived weight loss diet, or the word diet, doctors and patients perceive that they're going to lose weight. And when you lose weight, you lose muscle as well.
Yeah.
But what you're saying here is that the fasting nutrition is a fat loss, but protects the muscle, which is critical
Yes.
for the diabetic and cancer patients. We know that there's a
Yes.
lot of companies that specialize in those protein drinks as well, which, I don't know how controversial it is to drink high proteins when you have cancer and you're feeding the cancer rather than starving the cancer. And maybe this is an important balance with the fasting nutrition, whereby we're supporting you're creating the right environment for the body to host the chemotherapy, but you're not compromising on the muscle loss.
Yeah. Um, well, I think a lot of cancer patients get a lot of protein to preserve that muscle mass, to keep them optimally functional in terms of mobility, in terms of strength. But at the same time, I'm not so sure whether that is healthy, precisely because what you say, you somehow feed the cancer cells with all that protein as well, just as you probably feed your muscle mass. But so a fasting mimicking approach appears to be very useful because it makes you lose fat while it preserves your muscle mass. And there's not so many calories and protein in particular in there. That might be you're right, that might be a very
which is
important.
which is which is contrary to what the word believes, right? When you say, "Oh, you're not going to give my patients high proteins," is that good or bad? Because I went to med school, you went to med school, everyone, when we go and talk cancer, is like, go on low on carb, but then get your proteins. But cancer is the fastest growing cell in the body once you have cancer, right? And the more proteins we're giving that patient, we're helping a little bit on the muscle, but we're feeding cancer, you know, a great source for it to grow, and we're spiking IGF as a response, which again pushes the cancer for extra growth, right?
Yeah, yeah, you're absolutely right. You're
And so,
absolutely right.
so this cyclicity of fasting nutrition, I protect the muscle, I optimize the body around chemo, then maybe if that patient is a little bit cachectic after or needs some muscle protection, maybe certain proteins after and maybe plant-based and but
Hmm.
more on the ketogenic side, maybe. Is that something that you're
Yeah,
recommending so that you balance
yeah.
feeding the body but not overfeeding the cancer?
Yes, of course, of course. If of course there's cancer patients who lose a lot of muscle mass, and that impairs their strength and their mobility, and then you should make sure that that you protect that muscle mass, and you can do that perhaps by by eating, in particular, plant-based, a little bit of plant-based protein, but you have to take care, I'm sure, to not to eat too much animal protein to make sure that you do not feed the cancer as well as you feed your muscle mass. So you're absolutely right there, in my
Okay,
opinion.
well, we're excited to see where medicine is going to take us. This is pretty exciting to see how food as medicine can tag team with the current drugs and the standard of care and potentially protect the body or enhance the outcome. I mean, cancer has been always the struggle with it with medicine. So hopefully, with your work in the future, it seems you're onboarded a very exciting high number of participant trials and hopefully that can show significant results where I think patients around the world would be and doctors will be very excited to see the outcome of that one.
Yeah, I think so too.
So it happens that I think because of your belief in fasting and your leadership at Leiden again, which is one of the best university health system that I know of in Holland, you also did another trial on diabetes and used the fasting mimicking nutrition as well for diabetes. Can you
Yes.
talk a little bit about that protocol? Why the science? Why doing fasting nutrition for diabetic patients? What was the protocol and some of the outcomes?
Yeah, so we did a study in 100 patients with type 2 diabetes. So there's two different types. Type 1 is with the juvenile form, and then there's type 2, usually associated with overweight and obesity. So we did a study in 100 patients with who are overweight with type 2 diabetes. And what we show that one half got a fasting mimicking diet for 5 days, once a month, and the study lasted for 12 months. And the other half, and they got regular, diabetes care as indicated by Dutch guidelines. And the other half of the patients got just the regular treatment. And what we show is that the patients who got the fasting mimicking diet for 5 days a month used much less medication than the group that got the regular treatment. So the majority of the patients who were treated with medication at the start of the study who used the fasting mimicking diet could stop that medication. And while in the control group, people used more medication at the end of 12 months. So that's and while their glucose control was it was a tiny little bit better in the fasting mimicking diet group. It was, although it was not statistically significant, but it was a little bit better. And there was while they used much less medication, there was no increase of their glucose levels, right?
So
So,
you're saying the fasting nutrition had allowed the doctor to decrease the medication while the HbA1c staying stable or decreasing a little bit, so they're avoiding the need of medication and controlling the blood sugar at the same time?
exactly, that's what happened. And then we also show that if you use that fasting mimicking diet in this way over a year, you lose fat mass, you lose quite some body weight, which is particularly fat mass because there is minimal loss of muscle mass, while in the control group, there was an increase actually of body weight. And this is not unusual for people with type 2 diabetes or any one of us, basically. We tend to increase weight over time, but that was, counteracted by the diet. So I think we actually show very beneficial effects of the fasting mimicking diet in type 2 diabetes over a year.
So,
Um,
Dr. Hanna, this is one of the major reasons why I personally, departed from the clinical aspect of medicine and went into the discovery and development of healthy nutrition. It was diabetes and cardiovascular. I I
mhm,
I a little bit couldn't comprehend the system of. So we say diabetes treatment is keeps the blood sugar in a certain range. 90% of the medication that does it not by disappearing glucose, but by just transporting it further into the cells, which
mhm,
then the excess glucose gets into fat, which then increases insulin resistance, which then makes the pancreas more tired for overproducing insulin, which then advances the patient in the disease forward and get
mhm,
them more dependent on more drugs and then get their pancreas failing with time and then getting the need for insulin. And I couldn't comprehend the system where to fit within a regulatory definition of a disease, just keep the glucose within range, therefore send it somewhere else, and that somewhere else is doing more damage because it's creating more insulin resistance and pushing the patient forward in their disease. I just
mhm.
couldn't comprehend that system that is like it's an unconspired, of course, but it is kind of somehow the evolution of the system was just to get to. I've never seen a disease where the more you take medicine, the more you move forward with the disease.
Yeah.
And I always say diabetes type 2, to a certain extent, there's obviously genetic predisposition, lifestyle, etc. But it's to 80-90%, it's a food-borne disease, right? It's a disease of it's a prolongation of the overweight and insulin resistance pattern. And the solution, what you're saying today is, okay, you can eat healthy and undereat, you lose some muscle with it, but hey, we discovered that maybe if fasting mimicking nutrition helps you to lose the weight faster, but because it's a stress on the cells, the muscle gets protected and you're not decreasing muscle mass. So you hit two birds in one stone. The diabetic patients wants to protect their mass. That's critical for them not to pick up fat again fast. And you want them to quickly reverse insulin resistance and needing less medication. And
Mhm.
probably this is what the magic of the study that you did, that you led, is that satisfaction of there's a lot of feed healthy with a Mediterranean diet or a lot of other healthy nutrition. You will decrease HbA1c and maybe need for medication, but the weight loss is induced by fat and muscle. And I think this is where a lot of doctors struggle and a lot of patients struggle. And I think this is what's going to happen with Ozempic and Wegovy and all now this big hype with the GLP-1, we're seeing the patients losing weight fast, but they're losing muscle fast. And if you stop them, you're going to gain weight fast, and it's mostly fat. You don't gain muscle fast. You're creating bigger insulin resistance. You go back deeper into the disease, and it's like a lifelong dependence on the new drugs rather than a freedom from medication from them.
Yeah, I think the a major issue in the treatment of type 2 diabetes and many other chronic disorders, by the way, as we do it now, is that, we try to correct the physiological consequences of our behavior in the case of type 2 diabetes, food intake is a major issue. So we try to correct the consequences of the wrong food in combination, as you said, in combination with genetic factors. And also, don't forget the microbiota, the bacteria in our gut. So, in interaction with what we eat, glucose levels increase. And what we do with medication is we try to correct that while people keep on doing the wrong thing, basically. And as long as you do not correct the food intake, whether you do that with a fasting mimicking diet, we show now that you can do that by eating a fasting mimicking diet for a couple of days a month. There's alternatives, of course. You can also continuously restrict your calories in a prudent way. But it's very much more difficult to do that than to periodically use a bit more stringent regime. But you have to do something. As long as you keep on doing the wrong thing while taking those medicine, this disease is progressive. Exactly why, you explained that excellently, I think. So this is fundamental, I think. Dietary intervention is fundamental to the treatment of type 2 diabetes. I always learned that it's a chronic progressive disease. We heard that on medical meetings over and over again.
We
And
both went
this,
to best medical schools and still thought it's right. And I don't know how many hours of nutrition you took in your. I took one, and I'm
yeah,
MD, PhD, and two masters. All of them, I just took one session on nutrition, and that's the
yeah,
main cause of the main disease that majority of people with overweight end up with.
yeah, yeah. No, I think I can't even remember. Maybe zero.
Yes.
It's virtually nothing on nutrition, while nutrition is the basis of our health. I'm convinced that that
So,
is the case.
Dr. Hanno, I think that trial was done, finished, and now there's a version of the fasting mimicking nutrition that was recently launched, and people, I think, in the US and then next year in Europe can access that. Can you a little bit talk about the protocol of such a nutrition, like when a patient should do, say I'm a diabetic type 2 patient and I'm on 3 or 4 drugs, when should I take this? If I go to my doctor and talk to him
Yeah,
about it, what should
yeah.
I tell him? What am I suggesting here?
Well, we use that, or our patients use the diet for 5 days every month, but we are not sure whether, you can even do it for every 2 months for 5 days. That may be effective as well. We simply don't know.
I appreciate you very much, Dr. Hanno, for the great session today on generally fasting for longevity and specifically focused on the use of fasting and fasting mimicking nutrition for certain group of patients, especially you studied breast cancer, how to use that in cohesion with the current chemotherapy and using the fasting mimicking nutrition for diabetic patients. The protocol I think you tested was once a month for 6 months, and then once every 3 months to maintain and to help them regress for the first time from their health conditions. I think this is what some of those summits we are excited about, is just to bring that cutting edge technology in nutrition and how nutrition as medicine, as a tool for longevity, can join hand in hand with the current medication and the current healthcare community and empower the patient and the doctor to have additional tools to support their patients. Appreciate you very much.
Thanks for listening to the Longevity CEO. Follow the show and join us as we rethink what it means to live longer and healthier lives.